My name is Jörg Groth. I have been working as a senior doctor in the clinic for 35 years, treating patients with malignant diseases, primarily bronchial carcinoma, for example pulmonary diseases. Many patients who are suffering from such a disease do not arrive until late in the clinic for diagnosis. The symptoms are initially quite nonspecific in this disease. It can be a prolonged cold or cough that has persisted but has not yet been clarified. The radiological and laboratory tests are then carried out in the hospital, which sadly often confirm that this is a malignant lung tumor. The examinations are, on the one hand, very stressful for the patients, as are the often following bad results. In most cases, we cannot show them the desired results, which they would rather have. Talking to a patient and telling him that he has a malignant tumor is a severe invasion into his personality and, above all, his emotional life. For this reason, I was always on the go, searching for other ways and possibilities. The visit to the international congresses is compulsory. However, there were no breakthroughs here. By chance, I then came across Mr. Zwerger from Garmisch-Partenkirchen. I had heard that he was working on an innovative tumor detection test that could detect tumors in their early stages. We had a very intensive discussion and decided then to start our own study, with the aim of proving that this new test is capable of recognizing tumors at an early stage, even if they do not necessarily show clinical changes or symptoms.
Wenn sie noch nicht unbedingt klinische Veränderungen oder Erscheinungen zeigen.
I was skeptical at first because there are so many companies which are trying to carry out the appropriate tests, but which have not yet led to comprehensive success. So we started with the appropriate study. I was able to contribute many patients. The results showed them that the sensitivity and specificity were more than 97%. This was very surprising for me because due to the last decades, I had expected completely different results. Thus, the sensitivity and specificity of the test was significantly higher than the current tumor markers such as CEA and SCC. It is only when these tumor markers have been increased as one, more or less, responded. It made sense now to look at, can this new test already detect the early carcinoma? And it was indeed the case. With all patients who had a malignant tumor later, these results were accordingly increased. They were even higher with patients with a tumor marker in the advanced stage of tumor, CEA and SCC, was still negative. Basically, the results confirm the speculation that we are dealing with a highly innovative test that with certainty will be revolutionary for the future. Perhaps it is even possible that there will be new therapies following this. It is also possible that this is the single therapy for every kind of tumor. Naturally, this would be desirable for mankind. This would be a truly unbelievable thing. It would be a sensation. Of course, we also require financial means to make a test marketable enough to actually implement it.
zu einer Marktreife bringen zu können, damit er auch umgesetzt werden kann.
This should, of course, happen as quickly as possible, because every day people die from some kind of cancer. We all know the numbers. Once the test is approved, and respectively, when it meets the appropriate requirements, we would be in the position to start as quickly as possible. Above all, it is important that this test is to be understood as a basic test, as a screening test, which can basically be done by every general practitioner. The taking of a blood sample is a very small effort, and the laboratory tests can be carried out in the appropriate laboratories. It would certainly have the advantage for the patient that we would have an early detection. And for us doctors, it would mean that we could start the appropriate therapy much earlier on.